At the last ESMO meeting in Barcelona, we have presented our clinical trial regarding the use of anti-angiogenic therapy combined with surgery to improve the outcome of metastatic and resectable osteosarcoma. We're glad to say that our study has demonstrated the potential of improving the outcome of the resectable osteosarcoma patients. But I have to highlight that only applies to the second chance of cure, only applies to a minority of the patient. And unfortunately, the majority of our patients are still suffering from relapse and refractory sarcoma. And the next question in our head is that can we improve that outcome by moving forward such therapy to an earlier stage in our treatment timeline. What we really need is a biomarker to predict those responder versus non-responder. And using biomarker, we can maybe grab those patients out of the whole bunch of 10,000 of patients and to bring them earlier to the right therapy with the right target and to improve the curability of the outcome for these patients. So at this ESMO meeting at Berlin, we are presenting our biomarker-driven trial. And in this trial, as I talk about in the meeting, we have 3 arms in our early phase trial. We have patient will be all sarcoma histology can be recruited, excluding adipocytic sarcoma, and they can have either of the following positive biomarker. They can have VEGFR 604 polymorphism or the SNP cohort. They could either have a CSF1 gene high expression or amplification, which is the CSF1 high cohort, and they could either have chromosome 12q4. They could have chromosome 12q4 amplification, which is the chromosome 12q amplification cohort. And we are happy to present the result of the first 2 cohort in this meeting. As a result, in the SNP positive cohort, our primary endpoint was met. In each of these cohorts, which our primary endpoint was the 16-week progression-free rate being equal or more than 60% in the biomarker selective approach, as compared to the as compared to less than 50% as a non-selective patient cohort. I'm very glad that I'm very glad that our primary endpoint was met for both the SNP cohort and as well as the CSF1 cohort. In the SNP cohort, our 16-week progression-free rate is 74% in the biomarker-positive population, compared with 42% as in the biomarker-negative patients. And in our the mean progression-free survival is 2 months longer in the biomarker-positive patients versus the biomarker-negative patients. And in our CSF1 cohort, our primary endpoint was also met. For our CSF1 cohort, the 16-week progression-free rate is 70% in the biomarker-positive population, compared with 42% in the control. So in both of these arms, our primary endpoint was met. We really raised the bar of using the biomarker-driven approach of anti-angiogenic therapy in sarcoma, compared with the traditional trial and error approach and with the all-comer patients. So that's our main findings in this trial.